So it's all yours.
Okay, thank you very much, Cheryl. Good to see you again. And everyone, thank you for the opportunity to speak to you today. I'm hoping my co-author, Colette, will get on soon. If not, I'm happy to share and run with the program here. I'm going to share my screen if I can. And everybody see that? Yeah.
Yes.
And first of all, happy 10th anniversary to the Arlington Neighborhood Village. Let me first spend a little bit of time introducing myself. I am a former human resource executive, retired, and now have my own executive coaching and management development consulting business. It's called Wellness Consulting Group. And I was also the co-chair of a patient and family advisory council for a large hospital system in the area, as well as been on some board of some hospitals. And I have my coaching certificate from the Maryland University of Integrative Health, where I met Colette. And Colette is a physician. She's a gastroenterologist by trade. She was also an executive at a major healthcare company and is also the editor for the Wharton Healthcare Quarterly. So she's got a lot of credentials behind her. Let me get into this. And first, we thought we would get some involvement and some engagement with some true and false questions. And I'm going to give you some questions, and very quickly, if you can put your answers true or false in the chat, Gary's going to see how you all think. The first question is true or false? The healthcare system in the US is the most expensive of any developed country in the world. True or false?
So far, true, yes, true.
Okay. That was an easy one. Yeah, we are the most expensive. Just by the way, second is Switzerland. So we are by far the most expensive country when it comes to healthcare. And here are some resources for you if you're so interested. Number two, true or false, the average life expectancy at birth in the United States is now 77 and a half. That's 74.8 for men, 80.2 for women. True or false? Gary?
True.
Okay.
Everybody agrees with
Yeah, that is true. It actually had gone down during the pandemic, but this is what the current stats are now. It's gone up a little bit. But one of the questions is, are people, they may be living longer, are they in good health as they live longer? So that's part of the issue that we're going to be talking about today. Number three, true or false, the leading cause of death among women in the US is breast cancer.
False, true, false.
Okay, the answer is heart disease. So heart disease is the number one, not breast cancer, although it is prevalent. Heart disease is the number one cause of death in the United States. Okay, number four, about 25 million Americans do not have a primary care provider.
True, false, true. And somebody saying at least that
Okay.
many.
This is a trick question. It's actually over 100 million people do not have a primary care. So the answer is false. And number five, 70% of US adults do not have an advanced care plan in the event of a life-threatening injury. True or false?
True.
Yeah, it's at least that amount. Yeah. So these are some of the questions, some of the issues we cover in the book. And but we're happy to get into more if you have questions about these later. But let me start off with my story. There's a quote from Brene Brown. One day you will tell a story of how you overcame what you went through, and it will be someone else's survival guide. Very briefly, back in January of 2008, I had a seizure. I came home from work and had a seizure at home. My husband caught me before I fell and passed out and dialed 911. At the emergency room, they said, well, the good news is you didn't have a stroke. The bad news is you have a brain tumor. It's about the size of a golf ball and has to come out right away. And so within 10 days, I found a great neurosurgeon in a hospital about an hour away, and I had the surgery. It was removed. I was good. I was fine. I spent 3 months recovering and went back to work. At the end of that year, I noticed that the surgical site wasn't healing. And the neurosurgeon said, well, I'm going to refer you to a plastic surgeon. And so in January of 2009, I had another surgery to see what was going on. Apparently, the bone had become infected where they had to remove the bone, and he replaced it with a titanium plate. And the surgery, after the surgery, I went back to work. About a month later, I noticed that the surgical site was opening up again and wasn't healing. And in the meantime, he had referred me to the infectious disease. The plastic surgeon had referred me to the infectious disease department and put me on a lot of antibiotics for the infection. So in February, he went to the office and stitched it up again, even tighter. About a month later, I said, it's opening up again. And I went back to the plastic surgeon in April of 2009. He did a third surgery and said, this is really tight now, it will not open. Well, lo and behold, it opened up again. And every time I walked, I could feel the stitches coming apart. And I called him, I called the plastic surgeon, and I said, I don't understand why my head's opening up again. He says, it can't be, relax, go home and take a warm bath. And so I didn't know what to do. I would talk to some friends. In fact, you were mentioning a book club. I had some nurses in the book club, and they said, why don't you go to this other hospital where they have a wound care center and see what they say? I saw a plastic surgeon there, and the plastic surgeon said, you can't be going around like this. This is open. And I said, well, don't call the other plastic surgeon, call my neurosurgeon. He called me back, called in the chief of reconstructive surgery, and the chief of reconstructive surgery said, I know exactly what's going on. You're rejecting the plate. And so what I'm going to tell you is you're not going to like it. We're going to have one more surgery to take the plate out. Wait 6 months. You're going to have to wear a helmet to protect your head because you have no bone and no plate to protect your brain. And then in 6 months, we'll come back and put in a new plate. And first thing I said was, I can't work and with a football helmet on. How am I going to do that? And he says, you're going to have to wear something on your head. And the wonderful nurse gave me a baseball cap with a plastic plate inside that I wore to work for 6 months. And in February of 2010, I had the final surgery. A new plate was put in, and I was fine. However, during this time, the neurosurgeon had no understanding of what was going on with me in the same hospital, with the plastic surgery, with the infectious disease. And so there was no coordination. And as a result of that, I said, something needs to happen here. And if it wasn't up to me to be my own advocate, I would probably may not be here today. So that was the impetus for our book. And I wrote my story, and I was listening to a lot of other people tell their stories as well. And so I asked Colette, who had also gone to the Maryland University of Integrative Health, and we had done some training together and some presentations together. I said, would you like to join me in this book? And she gladly, and I'm very grateful that she joined me in this book. I don't know if Colette's back on or not. Gary, is she on? Probably not.
I don't.
Okay, I'll keep
Yes,
going.
I am on. Can you
Oh,
see me?
good, Colette. Yes, great.
Yes, I am so sorry to everyone. It's 2024 and technology is having a problem, and I'm dealing with a family health issue myself. So I very much apologize for being late.
Okay. Talk about a book, Colette. I'll leave it with you here.
So as Charlene was saying, she reached out to me. I was very happy to do so, having seen how complicated it was as a physician and as a caregiver. And it's always been my contention that people have much more power than they think that they do, even in a situation that is very overwhelming and intimidating. And so if people are left with nothing else than that message today as it relates to healthcare, is to remember that in the always present need to advocate for yourself if you're in a situation, as well as for any family members, friends, etc. The book itself, we broke into certain sections. We had a group of people who were very generous in sharing their own stories. So the stories in the book are actually real people and the lessons that they learned. And from that, we go into what people need to know and what they can do in particular situations to provide resources. But the take-home message is to take charge of your health. Next slide. I'm sure Charlene probably mentioned before that the book does not provide any medical advice. We just provide guidance and information about how the system actually works. And prevention is the best medicine is something that has not changed from the beginning of time. And I think that given the direction that we're headed as a country in terms of our healthcare, truer words were never spoken with the chronic disease burden, the impact of lifestyle, the impact of the environment. People are beginning to really wake up to it in the healthcare system, but each and every person has to take this on for themselves, because as you will learn during the book, that unfortunately, a lot of the time it is on you to make things happen.
Thanks, Colette. Many of the diseases that we see now with heart disease and stroke and diabetes and have led to a lot of death and disability in this country, and they're largely attributable to lifestyle. In fact, I've read up to 80% is attributed to lifestyle. So what are those lifestyle factors? And I'm sure many of you know this already, but just briefly to go over them, of course, smoking is one that has gotten a lot of publicity, and fortunately, the numbers have come down in the country, but the smoking, including vaping, have continued. And so it's still a major lifestyle factor to some of these chronic diseases. Diet, a lot is written about diet now. I kind of subscribe to Michael Pollan's famous quote, eat real food, not just processed food, not too much, and mostly plants. So we need to get a lot more fruits and vegetables and fiber in our diets. Some foods that have gone out of fashion have come back in, like eggs. There's nothing wrong with eggs. Depends on moderation and how much we eat. A lot has been written about the Mediterranean diet. But this is leading largely to a lot of the obesity factors in the country. And as well as alcohol as a piece of that. I was just talking with Gary. It used to be the standard was 1 drink a day for women and 2 drinks for men. Now I've read a lot of the research that talks about any alcohol is not really good for you. So again, moderation, so that's a tough one here, because a lot of it is part of our social network. So that's what the latest research is showing. Exercise, of course, you've heard a lot about this. Walking is good, really, any kind, if you can do it for 30 minutes a day. I don't want to leave out strength training as well. Doing, as we get older, we lose a lot of our bone and our muscle, and exercise is important to do that as well as some flexibility and yoga and stretching. Sleep. Oh, good Lord. I'll tell you, just to get 7 to 8 hours of uninterrupted sleep is a luxury these days, with a lot on our minds, and also some of the, a lot of the issues around some of our medications affect our sleep, and our worries affect our sleep. So there are a lot of ways to reduce our sleep that you've probably read about. to reduce the electronics before bed. Don't eat too late, to keep it cool and dark in our rooms. So sleep is a big issue. Stress, we all have stress in our lives. Some stress, a little bit of stress is normal and is good for you, actually. When you exercise, you're stressing your muscles, and that's good for you. But it's chronic stress that creates the burden, and whether we're feeling burnt out or so stressed that we're depressed, and our emotional health creates problems and leads to a lot of these illnesses. And finally, the last lifestyle factor, and which is so nice about this community, is that you form relationships. During the pandemic, a lot of people were lonely, were isolated, weren't able to connect as much with other folks, and it created a lot of depression in some people, in some folks. Loneliness, they say, is equal to smoking about 15 cigarettes a day. And so it's really important to stay connected with our friends and our family, both for our mental health, emotional health, and as well as our physical one. Colette?
And I will just add one thing on what Charlene just said about relationships and social isolation. I was actually reading something this week that talked about the brain changes that happen with loneliness that then impact your eating habits, the craving for sugary foods, the craving for greater food intake that then gets you into a cycle of unhealthy eating, and then it just goes from there. So hang out with your friends if you want to manage your weight. I will, everyone knows that you need to have a primary care provider. I think everyone is aware, unless you're very, very lucky these days, that it becomes increasingly difficult to find someone. A lot of people are not taking new patients, and the shortages are present for sure with regard to physicians kind of across the board, but particularly in primary care. The pipeline for new physicians, for nurse practitioners, for PAs is not sufficient, at least at the current time, to meet the needs as everybody is getting older. And we have a large cohort of people who are getting older and having issues all at the same time. I will let you know that I myself have had a nurse practitioner as a PCP in the past. I knew the physician in the practice, so I knew if any issues came up that that person would be there. But the person that I had was wonderful. She was very knowledgeable. And so if you have hesitancy about that and there is a nurse practitioner available, or depending upon the practice, a PA available, I would at least give that a chance. And that may occur when when the physician isn't available, and you'll meet someone and you'll kind of be able to test them out. Checkup, screenings, immunizations. I think the past 5 years have told us the importance of all of these things. People who had not been living a healthy lifestyle, people who had not been getting their screenings, people who had not been getting their immunizations, were in a more vulnerable position when it came to becoming infected with the virus. And so I've always said that COVID-19 was like this commercial for taking care of yourself and making sure you have someone who is working as your partner in terms of keeping you on track to get all these things done.
Right. In addition to your primary care provider, medical provider, it's important to see your dentist. Sometimes we like to put this off, and people have sometimes an innate fear of a dentist. I have to be self-disclosure. I'm married to a dentist, so I know this area. But in addition to just checking on your teeth, at least there's an issue of additional root caries in seniors. The biggest issue, I think, as we get older, we have some periodontal problems. That's inflammation of the gums. And the issue is that these infections, or the inflammation that is found, can lead to heart disease, can lead to diabetes. The bacteria gets into the bloodstream and travels through the body. So if we're not getting good home care by brushing and flossing twice a day, and seeing a dentist hopefully twice a year for cleanings, sometimes more if you've got some problems. That can lead to other health conditions as well. Dentists also check for oral cancer. And that's an important reason for checkups, and just like we go for our regular care. And remember, the good dental hygiene is only as good as what your home care is. Invest in a good electric toothbrush if you can, and flossing is important as well. A lot of people ask about dental insurance. Some Medicare Advantage plans offer it. You have to check and see what it covers. Some cover, a minimal amount, and if you need some extensive work, it can get expensive. So just something around dentistry there. Colette?
And I think all of us have probably had situations with our insurance coverage, either in terms of what it covered, whether or not it was available and affordable, whether or not something was denied. So the importance of knowing in advance of being in a bad situation, actually what is available to you with regard to your health insurance, as well as programming that is actually there to help you, although most people don't think necessarily of their health insurance as the first thing in terms of someone can help them while they're having difficulty navigating. One of the big points I'd like to make is it can be very time consuming to pursue appeals if something has been denied, but I think that it is very much a lost opportunity, and that if you have the time and the wherewithal, that I think it is well worth pursuing appeals, because a high percentage of the time those will end up getting reversed, because a high percentage of the time the reason for the denial is that the clinician has not provided sufficient information to make a decision to approve. And so, like I said, it's time consuming, it's tedious, it can be infuriating, but if you have the time to do it, I think it's definitely worth doing.
Great. One of the hardest things and most important things when you do see a physician is how much communication there is. And does the physician listen to you and answer your questions? I like to advocate for people to make a list before you go of the questions and concerns that you have. And sometimes it can be intimidating. So you really want to make a list that you know of things you want to know, and take notes when you ask those questions. Sometimes it's helpful to have, if you can, have a family member or a friend come with you to take those notes, because if you're in an emotional state or you're very nervous, sometimes you forget. So that's why sometimes having somebody come with you to hear what the doctor says is important. It's also critical that the physician knows all of the medications, even the over-the-counter supplements, and any herbal medicine that you're taking, because some can have some negative effects. And also provide all the medical and family history that you know, whether you're allergic to something or any past procedures that you have that might have a bearing on the diagnosis. One of the things that one of the best physicians I have, who I really cherish, says to me at the end of the session when we're meeting, what do I need to know about you in order to provide the best possible care? And it could be anything, about, what's the follow-up going to be, or what do I do if this happens? But he always asks that question, and I think that's important in the communication process. So you really want to be a partner with your doctor, and it can be intimidating because they're in a position of authority and you're out of your element. But I like this quote from Sir William Osler, who says, "The good physician treats the disease. The great physician treats the patient with the disease." And to get to know you and what's important to you, because any partnership that you have is really based on mutual trust and respect. And if you feel that the physician doesn't respect you or isn't listening to you, or doesn't, just like the one that said, relax, go home and take a warm bath, I stopped seeing that person. I'm not going to go there anymore. So this is really important, establishing that relationship. Colette?
So asking for a second opinion, this is another scenario that can be sticky for some people and feel uncomfortable depending upon the particular situation, how dire it could potentially be, or the approach and personality of the person that they are seeing. But I would say that it is definitely worth doing in certain situations when you feel as if you aren't comfortable with what has been offered, or you feel that there may have been other options out there that you aren't hearing about, or if it is a scenario where the options that are available are very, very different with very different pros and cons. I myself, when I was in practice, would actually send people for a second opinion because my thought was always that no one knows everything. And there are going to be times when things are gray, and getting a few more people and their perspectives in the picture was helpful. And I always was very grateful for that input. And for me, it was not a problem for people to get a second opinion. However, I do know that there are physicians who are not like that, but it is at the end of the day, it's going to be you, your family member, who is going to be going through the procedure, the surgery, the chemo, um, or, and it's your life on the line. And there are particular areas in clinical medicine where a second opinion really does make sense if you're reluctant, and cancer is one of those. When studies have been done about diagnoses that people have been given, a high percentage of the time when they've gotten a second opinion, the second opinion was very different than the first, because on looking at the pathology slides, for example, it was a different diagnosis, a different stage the um, of the disease. And so while it may be difficult, once again, the self-advocacy piece and thinking about what is going to be best for you, because you are the person who's going to have to live with the consequences at the end of the day.
I just want to add one thing is it's very easy to be intimidated or afraid you're going to offend a physician or provider if you ask for a second opinion. I once had someone who wanted to up the medicine and I didn't want it upped, and I wanted to get a second opinion, and he told me there can only be one captain of this ship. So I said, well, I'm going to do it. I didn't argue. I just went to another physician. So I think it's really important that you use your advocacy and get the answers that you need. Wanted to take a moment and talk about the patient portals. A lot of, I'm sure most of you, if you're going to see a physician or a provider's office, that you're going through a patient portal to get all the information in. There are some pros and cons. The pros are that it can save time if you know how to navigate it, complete the forms, and you can get all the information prior to the visit, all your insurance information and so on. They can send you reminders of upcoming appointments through the portal. Very often they do that. Very often you can find a summary of your previous visit or the doctor's orders, what the follow-up was, and it's there. It's also there for some other providers if they're in the network, to see it as well. You can get results of your labs and your radiology tests or any kind of blood tests that you might have, that you can see them on the portal. Now, sometimes you may see them before the doctor does, and that can be a problem. But I like it because I can say, okay, I don't understand this. I want to ask a question. But if something looks suspicious, it could make you nervous or make you upset. So you need to let people know whether you want to know that in advance. You can also communicate some non-urgent messages by sending messages through the portal. And if it's just a question that you have, you can do that as well. However, and this is the big issue with patient portals, one is physician practices and facilities have different systems. And the problem is they all don't work the same. They often don't talk to one another, they don't coordinate. So if you put all your information in one portal, it doesn't mean that the other physician or that practice knows what you put in the other one. And that you have to ask your doctors, do you really use the portal? Do you really check it? If I send you a message, do you really see it? Some doctors are great about it, some just aren't. And I know, Colette, you've had some interesting comments about that too, or experiences.
Portals are the headline there is portals are not my favorite. And you can see for someone like me who can have a technology scenario like this morning, that how interesting trying to get through a portal, etc., usernames, passwords, what a joy that can be. So
yeah. The biggest issue, I think, with the healthcare system is really the lack of coordination of care. And in the situation that I talked about earlier, I was in the same hospital, I was in the same facility, and the doctors didn't talk to one another. They all don't work as a team. And so you want to know who are the people that are going to be, and who's on the team, and who's the quarterback of the team, who's coordinating it. Apparently the neurosurgeon had no idea what was going on once he handed me off to someone else. You want to make sure everything that happens is documented and the treatment is shared with, particularly with your primary care physician. Keep all the portals updated and keep that information. Sometimes if I'm getting something done in somewhere else, maybe with a lab that's not part of this portal, I have to put the record in or send it to them to make sure it gets uploaded. Make sure all the medications, as we get older, we're on a lot of different medications and supplements, maybe up to even, less, up to 10. And so people need to know what you're on and when do you come off of it. The bottom line is you have to coordinate their care. The system doesn't allow it to happen naturally. And unless you make sure every physician or every provider knows what's happened with the other ones, something's going to get lost in between in the cracks.
So there has been in the past, and I think to a significant extent is still the case, that there is stigma around emotional and mental health issues. I think it's gotten a lot better over the years, particularly after the literally global trauma that we all went through. And so I think people are more comfortable talking about things and seeking help. But it's so important to recognize that your emotional health is as important as your physical health. And so much of the interaction between the two can turn either into a positive cycle or a very vicious cycle if you are not addressing it. So, for example, if you're a person who has a heart attack and you're depressed at the time, you're much more likely to have a second heart attack than someone who was not depressed when they had theirs. And that's just one example. And I think all of us can, if you've ever been depressed, that feeling of not being able to just get out of bed in the morning, not want to have any light in your eyes, the idea of doing anything at all is too much. But so you know what an impact that can have on your life. But the bottom line is to talk about it and to make sure that you do seek support. Particularly now, there are a few more resources available with the onset of more companies offering telehealth. And overall, the studies have shown that that can be as effective in terms of virtual care as in person. There are always going to be situations where in person is probably better or preferred or more effective for some people. And the other thing that I would say that for your emotional health in general, that there are other ways to balance it, maintain it, to consider so that you are feel grounded as you go through your day, as you go through your life. And some of them that Charlene and I have tried ourselves have included tapping. And I know Charlene probably mentioned zero balancing being very important to her, mindfulness and meditation, or just taking a walk out in nature. The science just could not be more clear about the importance of that. And even for patients who are in the hospital, there are some hospitals where if the rooms don't have a window out to the outside, actually have like a scene, a nature scene. And there are differences when they, patients who are in that room in terms of their stress levels, et cetera. And, once again, stress is something that cannot be avoided. Chronic stress, it ravages your body and your mind. And so if you were a diabetic and your blood sugar was off the charts, you would, or at least most people would, do something about it. Being down in the dumps for a prolonged period of time is as much of a 5-alarm fire as that. So once again, at the end of the day, it's you, and you do what you need to do to get the help that you need, and seek the support that is out there right now. And I think that a lot of times people don't want to say anything to other people, but I think when you do say it to other people, you'll be pleasantly surprised by their reaction. Everyone is thinking that they're the only one. And at the end of the day, as COVID showed us once again, none of us is safe from emotional distress. I want to talk briefly about health disparities which exist within the system so that people are aware that they do, and so that they may be in a particular situation where the care that they receive, the options that are mentioned may be different for them just because of bias in the system for a variety of reasons, or for example, women and the care that they get in the emergency room when they show up with certain symptoms that may be different than the typical of someone having a heart disease, because the studies, the research was, and what you see in the movies is the stereotypical chest pain, left arm, jaw pain, which is still the most common way that women present, but they may present very, very differently. It may be back pain, it may be nausea, it may be overwhelming fatigue. And it's not uncommon for them to be told when they present that they've got GI issues, and then go home, have their heart attack, come back, and then they're also treated differently in that situation. The other is around medical gaslighting that can further health disparities. And Charlene gave you a great example when she was told to go get in a tub. That medical gaslighting is when your fears, your concerns, your symptoms are ignored or poo-pooed or put off to stress, put off to hormones. So just to be aware of that, and yet another reason to educate yourself and to look for opportunities when it's necessary for you to advocate for yourself. I know that someone had mentioned in the chat that this is a heavy, 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 heavy burden, and it shouldn't all be on us as patients. And I couldn't agree with you more. The unfortunate reality is the system is such that to put yourself in a position where you have given it your best shot to do what's best for you, or what you think is best for you, or a loved one, at the end of the day, as someone else said in the chat, no one's going to care more about it than you are. And therefore, as unfair as it is, particularly if you are ill and not feeling well, unfortunately, the system is such right now that a lot of the time, a lot of the burden is going to be on you as the patient, you as the caregiver, and that's just that's the reality.
Thanks, Colette.
And then,
Go ahead.
oh, and then with regard, oh, I'm sorry, Charlene, were you going to say something?
No, I was going to go on to the last slide that we have, is just really planning for the end of life and the inevitability of it. But a lot of us are not prepared for it. And it's a very tough subject. First of all, long-term care. is one that I don't know if everybody, knows about it or has some. It depends on your financial situation, but it's better to sign up earlier than later, because long-term care, if you should become disabled or you're alone, you have no other options, it might be an option for you. Again, if you're going to go in for surgery or into any procedure, you need to have an advance directive. And you should have this is all to do before anything happens, before the surgery, before the illness, so that there's clear understanding of what your wishes are. And to designate a power of attorney, whether it's a spouse or a partner, family member, or a friend, or someone that can make those decisions for you if you are unable. And to see an estate attorney. Some of these things can be done online now, to update your will and make sure it has what your wishes are. I was just talking to somebody who lost their husband, who said, thank goodness we made a list of all of our accounts, our passwords, what payments are due. She says, I would have never known how to get into his computer or his phone, or knew where the safety deposit box was if there was one. So to make a list of all those just in case. And also just knowing who they're seeing and what medications they're on and what the dosages are, because sometimes people, even someone you're living with, doesn't know or doesn't have any idea who to contact. So that's important to make a list. Palliative care, and this is not just for the end of life, but for someone who needs support to stay out of pain and to help with easing their comfort levels, is important, as well as at the very end of life, hospice care can be very helpful and supportive to people going through this. Anything else, Colette, here on this?
The only thing that I would say is just think through situations. I mean, I think for most of us, the picture that comes to mind when it comes to end of life is someone who has enjoyed many, many, many decades of life, but that isn't necessarily the case. All that has to happen is a car accident, for example, or look at the situation recently in Michigan where the person drove through the beach club with 2 kids that ended up dead, and there are 9 people who are in life-threatening situations. You're going to a birthday party and your day and your life changes in 5 minutes. So the earlier that you take care of this, have those uncomfortable conversations, the better. I always tell people as soon as they can afford it, to get long-term care insurance, because it's only gotten more expensive, more difficult to get, more affordable. The other thing that I will say to Charlene's point, when my father died, and he was very pristine about keeping all of these records, it still was a scenario of it was a year for us to get everything straightened out once again because of the way that the system operates. So when you are doing this planning, you're doing it for you, but you're also doing it for the people who are left behind. I spoke to someone this week. Unfortunately, she had gone out to celebrate someone's birthday. When she came home, she found her husband lying in the driveway and he had died. And this was someone who was thin and taking care of himself, and they had just been to the gym that morning. So you just never know. So another commercial for being proactive and doing what you can to help protect yourself.
Well, that's our presentation. I know we went through it quickly. There's a lot more detail and resources in our book, which is, if you want to learn more, that's the website. But we're open for any questions or thoughts. Gary, you want to let us know what came up in the chat?
Yep. One of them was in the mental and emotional health slide. You mentioned zero balancing and tapping. Can you define those for us, please?
Well, they're very interesting. I went to someone who was very skilled and a master in zero balancing and qigong, which is, and you think, what is this woo-woo stuff? It's actually, you're fully clothed, you're on a massage table, and they look for different pressure points in your body where you're holding on to stress and trying to relax but you need to go to someone who's knowledgeable about this and who's understands what that is. Tapping, and there's another name for it. Maybe
It's emotional freedom technique, or
EFT.
EFT.
Yes.
It is something, there is science behind it. There's certain points on your body that you can tap to release emotions and everything that comes with it. I will say that it can definitely help relax in the moment, which is one of the things I have done tapping myself. As you can tell, a lot of what's in the book are things that have been tested by us ourselves.
Yes, yes.
And I saw the power of tapping, and like anything else, like a medication or anything else, it's going to work for some people and not for others. It's going to work for some situations and not for others. But during my father's hospitalization, which actually ended up being the one during which he died, he was very restless and uncomfortable and anxious. And I did tapping, and I'll just demonstrate, like, one of the tapping points is in your forehead right here. And I tapped that, and just right before my eyes, he relaxed. I know that it sounds crazy, but for some people, it definitely does work. And like I said, there is science behind it. The good thing about it is you can read about it, you can do it. It's not, it's not invasive, and it'll work for you, or it won't, or it work for you in some situations or not. I will say that I think kind of what I experienced with my father is probably not the norm. It's something that you do more and more over time, and you find the situations where it works for you. But I guess the point that we're trying to make is there are lots of things out there that you may not hear about because the medical training system is not making people aware of those. And there are people who also have a view of anything that doesn't, strictly go by the book of Western medicine and randomized controlled trials. But randomized controlled trials cannot be done for everything. And just because in this country we don't know about it or we don't think it works doesn't mean that some of these techniques that go back thousands of years and have science behind them don't work. On the other hand, just don't get sucked into certain situations where people are asking you for a lot of money, because that may be one of those things that what they are talking about actually does not work, and it's a scam. But keep your mind open, do your research, and depending upon the modality, there are kind of rules, regs, licensure, certification for practitioners. So look for that as well.
Gary, I did tapping between my 4th and 5th surgeries because I was so anxious about it between that time. And it was wonderful. And so for a 2-hour session, and he tapped my leg, and you tap it and you free associate and get rid of some of the anxieties, and it worked great. So again, I think what Colette is saying is look for somebody who's reputable, and it's not a scam. Okay.
Yes, and we've got several comments from people in the audience who are also tapping and find it very useful, calming, centering, helps with sleep. So
great.
now we've got a bunch of comments and questions that are sort of all over the place. One of them is you were talking about getting second opinions, and this person said patients themselves can initiate remote second opinions with providers like the Cleveland Clinic and other folks like that.
Yes.
She said there's a lot of legwork involved getting documents and everything else, but as Colette said earlier, nobody cares more about your health than you do, and being able to get somebody remotely that can, reassure you or steer you in a new direction has a lot of value.
Good.
I will say that there also are companies where they will do all of that legwork, and they're very good at doing that in an amazingly short period of time. Of course, there is expense related to getting some of these second opinions, so it's not necessarily an option for everyone. But depending upon the service that you use, it can be exactly what Nancy has said in terms of all the work that has to be done. But there are companies out there that take all of that on for you.
Great.
Okay, on the portal issue, I've got a couple of comments here. One of them was somebody who's had instances where they spend all this time filling out the forms and putting in all this information. And then when they get to the office, they're asked it all again. So, what was the point of that?
Well, yeah, unfortunately, that does happen sometimes, and it's more of the administrative problems, I think, in running the office, and they're doing a lot of things. So I think you have to, be there. Look, a lot of these people are stressed as well at the offices, and so I don't want to be adversarial with them, but sometimes it can be frustrating. But you just have to bring it along with you. Bring your insurance cards with you.
Well,
And the
and I
other
would say not
question-
just, oh, I was
Go
just
ahead.
going to say, this may sound a little bit subversive, and I think you can tell kind of my slant to patient portals. I mean, the ones that are good and the offices use them are fantastic. The problem is that so many of them are not like that. And so I had I had my own instance going to the GYN. This wasn't even filling out a whole bunch of forms with the pre-check-in. And then when I got there, it was do it all over again. And I heard another patient saying, well, I'm never going to do this again because what was the point? And, I was saying the same thing. So I usually, for that reason, don't necessarily, unless I know the practice well and whether or not they're really using it. If I don't know that, then I don't fill it out there. I just wait until I get there.
Okay.
Gary, one of the things, just to let you know, this is not to be adversarial with the healthcare system. It's to know how to navigate it. And you're going to
Right.
find things like that all the time. What my words of wisdom are, you want to be politely assertive. You want to make sure you advocate for yourself, but you're not there to be antagonistic or be the problem, because we're all human, and their mistakes are made. So we need to push and make sure you are politely assertive and taking care of yourself.
We've got a couple of comments here from people that have had very good experiences with physician's assistants or nurse practitioners as primary care providers.
Wonderful.
And so that is definitely something for people to keep in mind. A couple of things about dental insurance. One of them saying a lot of dental practices don't take insurance, so that's an additional problem. And a lot of the plans don't pay very much. And somebody else who said he had a semi-annual visit to his dentist rejected because they were a day or two before 6 months after their last appointment. So, no flexibility there.
Yeah. That's why you have to know, before you even sign up, you have to know what it covers, how much it covers, when does it kick in? If you get something where you have to wait a certain waiting period, know what that is. I think it's and it's complicated. The insurance matters are complicated, but that's why you got to do your research.
So comment here that they appreciate what you're saying about self-advocacy, but they've also seen people getting too involved with their care or the care of someone they're caring for, thinking they know more than the doctors do. Can you talk a little bit about the limits of self-advocacy and, when you might want to step back and say, I'm getting way too involved in this?
So I think that's where what Charlene said in terms of the being respectful but assertive, and to the point about there are people who do, when I think about self-advocacy in a particular situation, there are people who do know a lot about what's going on with them. And there are people who think that they have their own medical degree off on the side. I think that is when you look at, how many people are patients, that comes up pretty frequently in absolute numbers, but as a percentage, I think that's relatively small. I think that it becomes important when you feel like you or your family member is not being treated respectfully. When you are being told very prescriptively, this is what you need to do, and you are not being given all the options, or you aren't being told what the pros or the cons are, or if you feel that the person giving the advice is really pushing hard in a particular direction that seems to come from a place of bias. And I will say, with the situation that is going on with me personally with an aunt, and I've seen this with another aunt going to their doctor's appointments, it is not uncommon in my experience that for certain people in the healthcare system, once people reach a certain age, they have opinions about how much should be done. And also, people start to become invisible to them. So I would go to an appointment with my aunt who had total clarity and knew what she wanted and didn't want. And they would be talking to me, and I would say, right here, and there's nothing wrong with her. You need to be addressing her. So I think that it's also important for you to be asking questions, not just accept what you're being told, unless it's someone in whom you have total faith, and keep asking until you understand what the person is telling you, and to then kind of summarize to make sure you have interpreted correctly. And that to do it in a diplomatic way, as Charlene has said, and recognize your limitations. Just like I think the clinicians, particularly in a hospital situation, and you're dealing with hospitalists who have never seen you or your loved one before, and probably won't see them again, and hasn't seen you over time, to make sure that they know what's going on, to listen for them saying things that might indicate that in the handoff from one person to the other when they're switching, that not all the information was conveyed, to listen for the person before them who might have had a bias, who has told your story in a particular way, that this person has now picked that up, and it comes through what their recommendations are. And to be just very looking at the body language. Is the person saying one thing, but their body is saying something else? So I'm not saying to take over the case and to be very aggressive, because that's not going to end up in a good place for anyone. But by the same token, if you are feeling like you don't understand, if you feel like one person is saying one thing and another person is saying another, in this situation, then and with my aunt, talking to 5 different people during the course of the day, each one had a different thought, each one had a different plan, and none of those things were happening because no one was on the same page, to Charlene's point. So those are kind of the things that I think of when I think of self advocacy, not taking on becoming the attending on the hospitalization.
One caveat to add to that, Colette, thank you, is my daughter, my grown daughter, who's 41, was in the hospital recently and didn't understand what the recommended treatment was or what was going to happen. And so I intervened and started asking questions, being the advocate for her. And immediately the person pushed back and said, well, she's a grown adult, and because of HIPAA, I can't tell you anything. And so I had to retreat and tell my daughter, you better ask these questions, because they're not sharing it with me unless she designates me as someone that can share the information. I can't advocate for her. If it was a child, it'd be different, but as a grown adult, she needs to advocate for herself there unless she designates me as someone that can share information with. So just a little caveat there. Gary, anything else? I know we're running long.
Well, there's one comment that kind of relates to second opinions, that they've experienced some specialists who seem to be encouraging additional procedures more to raise their own revenue than because the person felt it was really necessary.
This happens actually in dentistry a lot. You'll go in and one dentist will give a treatment plan that's several $1,000s of work that needs to be done. And, I always say, get a second opinion. And sometimes the work isn't urgent. It doesn't need to be done right away. Some of it may, but if you feel like there's a lot of procedures or a lot of, a huge amount of work that they're prescribing or some procedures prescribing, get a second opinion for sure and see, is this really necessary? Particularly, I think a lot with medications, are there alternatives to certain medications, or if you have a reaction to it, or is this really necessary? Can I take a lower dose? Sometimes you need a second opinion, and I've experienced that myself.
And
Yeah,
I would
I'm
say
looking
that,
for.
oh,
Pardon?
sorry.
Go
Go ahead,
I was
David.
just going to say, I'm looking for a new dentist for exactly that reason.
I hear you. It happens all the time, all the time. I hear it from my husband all the time, I'm sure. Anyway, go ahead, Colette.
Oh, no, I was just going to say, if you are having that feeling, I think, as you'll hear us say, to ask questions. And so if I would just ask the question of what is the purpose of that? How important is it? What is it going to add to the picture? Is it going to make a difference in terms of what the treatment plan actually will be? And I think if you're getting a very strong, uneasy sense that that's what's happening, it may be that all of those things are completely legitimate. It's a complicated situation, and what may seem like all those things aren't necessary actually are because of your particular situation. But if you are getting that very strong sense and uneasiness, then I think it's probably worth listening to that. And to Charlene's point, finding out or asking your primary care physician what that person thinks. Does this sound reasonable to you? Or is there another path? Or is there someone else you think that I should be talking to?
And by the way, when I get a second opinion, and maybe I'm a little suspect here, but I tend not to, if they say, oh yeah, I'll refer you to somebody else, I want to get my own second opinion, because I don't want someone who, out of their professional courtesy is going to automatically agree. So I want to find someone generally on my own, is what my take on it is. Anyway, Gary, anything else?
Well, let's see. One last one. We talked about taking notes or bringing a note taker with you. They said if that's not convenient, what about using the recording?
So I would say a couple of things that I think out of just courtesy, you need
Well
to,
enough to do, or do you end up garbled recording it?
Can you hear me?
Yes.
Okay, I would say that just out of general courtesy, I think that that's something that you should ask the other person, but also from a legal perspective, depending upon where you are, which state you're in. If you record without the other person's consent or knowledge, that's actually illegal. So for two reasons, you need to ask. I think if the person is okay with that, then it totally makes sense to me. I saw a question about a coffee and conversation with a death doula when we were talking about the end of life. If that is of interest, I actually do know someone wonderful. She also does guided imagery. So if that's of interest, happy to provide that
Yes,
information
please.
to you.
Can you put her information in the chat or get back to me?
I will. Should I send the email back to Sarah, or?
We'll send it back. We have Gary's email. We have.
Yeah, send it to
Okay.
me and I'll forward
Okay.
it to Liz.
Okay.
Well, I think we're, if we're, unless there's anything else, Gary, that you want us to answer, have we exhausted most of the questions here?
I think so. I mean, there were a few questions about your story, people wanting to know how is it that a titanium plate gets rejected and what did they replace it with?
Well, we'll have to figure that out, and we'll have to tell them another time, okay?
Okay,
All right. We just want to thank you so much for allowing us to share our information, and it's a pleasure to meet all of you. So hopefully this was of some help to you.
And
is
happy
it possible
anniversary.
can we get a copy of your slides? I mean,
Okay.
actually, I've got a copy, so if it's okay with you, I'll forward them to the office for anybody that wants them.
Okay, Colette, you're good with that?
I am.
Good.
Are you guys okay with people sending you emails?
Sure. I think you have our email address, do you not? Yeah. And we're happy to provide any help. We do not endorse any particular practitioners or hospital facilities. So if you're asking us, for that's, I want to make sure that we're not, we don't want to get into any trouble with any particular facility or physician.
Right. I just thought that if you were willing to share your email address, both you and Colette, good morning. Nice to see you again.
Hi, Cheryl. How are you?
Good. Nice to see you. Thank you for,
Okay.
this was an outstanding presentation. I did go ahead and put the program, the Aging Matters program, on the chat. So
Right.
if friends or colleagues didn't hear this today or want to augment what the two of you said today, that would be wonderful. So let's see, it is already 11:10. So we're going to close out this session and thank everybody for coming. We had a record attendance today. And interestingly, next week on Coffee and Conversation, the topic will be about cancer, life with cancer, with Marie Kelly, who is a pediatric behavioral health therapist. So be sure and tune in next Wednesday at 10 o'clock, and everybody have a good week.